Berlanga. I own the Medical Procedure Center here in Midland, Michigan. So I'm a board certified family medicine physician, and so we get a lot of training on office procedures and skincare and surgical procedures here. So skincare is a very big part of what we do here at Medical Procedure Center. We do a lot of skin cancer screening or evaluations for skin lesions that people are concerned about. Because most people are wondering, do I have a skin cancer or not? And so that's the question that we answer specifically. We want people to know if they have something that they should be worrying about or not. And we don't like individuals to go months without knowing if they have a skin cancer or not. So we look at the typical skin cancers that a lot of people are worried about. They have special names like basal cell carcinoma, squamous cell carcinoma, or even melanoma. And skin cancers are a very common problem in our country. And so if someone has a skin lesion that they are worried about, we can look at it with a device called a dermoscope, which allows us to gather a lot of information about that particular skin lesion. We can biopsy that and have that looked at by pathologists. We can look at an individual for an office visit from head to toe. We can do it with a dermoscope. We also do it with a system called a Photo Finder ATBM screening system, which allows us to look at the skin lesions or the body with high resolution photography. The system is able to track those skin lesions, and if there are new ones or they're getting bigger or they're changing, the artificial intelligence in the system lets us know that there is a change, and we can then look at those changes to see if it could be a skin cancer and requires a skin biopsy. So as far as skin goes, we can manage all the types of skin cancers. We can do warts, and we have a lot of different ways that we can manage warts. We can look at lumps and bumps, and we can take those out to make sure they're nothing concerning, because sometimes what seems like a benign little lump can actually be something more serious. Oftentimes they are benign. They have fancy names like lipomas, which are called fatty tumors, but they're not cancers. But cysts also, we take out a lot of cysts. Those can be cysts that are irritated and inflamed, sometimes infected, and we can manage those effectively. We can drain the cyst, we can treat with antibiotics. Once they calm down, or if they've never been bothersome, we can take them out before they ever become a problem, which I think is very, very important. Because what can be a very small problem can actually become a very large, irritating, big problem if not managed at the appropriate time.